All right, part 3, right? All right. We know it can be a difficult time. There are different discomforts that women experience. Some are common within each trimester. Okay, so we'll be talking to them about all of that. Different things, nausea and vomiting, primarily the first trimester. I'm going with what ATI says, but please. Nasal stuffiness, that's from the vascular congestion. Heartburn, we know. The relaxing of the esophagus and the decreased motility of the GI tract cause that. Ankle edema, varicose veins, hemorrhoids, all of that is because of the sluggish blood flow back to the heart from the lower extremities. Constipation, just another fun part of pregnancy. Backache, leg cramps. Now, if a woman's having a lot of leg cramps, we would probably want to talk to her about a diet initially. All right? So let's look at her calcium intake, her magnesium. Is she drinking enough water? What's going on? So we would ask about stuff like that. Just because if it just means increasing her, having a banana every day for potassium or whatever it is. But I have found that a calcium intake can affect muscle cramps. So, and dehydration. So we would do a dietary evaluation for them to see if we can't counteract that common discomfort. They might have shortness of breath. Yeah. Round ligament pain. So about the 20 to 22nd week mark, the round ligaments are the ligaments supporting the lower abdomen. All right. Again, we have those hormones running around to relax everything, and we have a growing abdomen, and that ligament is stressed. It's having to support a growing, heavier abdomen. So it's about the 20 to 22nd week where the round ligament just complains a little bit. And they call saying, there's something wrong, I'm feeling a pain, And then when I don't even look at how many weeks they are yet, I say, tell me about the pain. Well, it's going from my hip to my belly button. Is it worse when you move? Yes. You must be between 20 and 22 weeks pregnant? Yeah. Round ligament pain. And again, in the absence of other symptoms. So, it does go away. Supporting the... Yeah, some women wear just like support bands to help with those ligaments, to help the ligaments support the lower belly. Supporting the belly during movements, that sort of thing. But eventually the ligaments kind of give up and say, fine, I won't complain anymore, I'll just do my job. And it goes away.
How many weeks are they pregnant when this happens?
Usually it's about 20 to 22 weeks pregnant. That just seems to be when the ligament is beginning to stretch more than they like, and they protest. Vaginal discharge is probably hormonal related. There's different things you can do to counteract, but I will pay anyone $1 million if they come up with some strategy for morning sickness during pregnancy. Eat crackers. All that did was give me something to throw up when I finally got out of bed. Right? Anyone else? Yeah. Don't drink liquids while you're eating so that the food doesn't just slosh around in there. There's different, good times. Lots of different things. Avoid greasy foods. All right.
It helped me.
It helped you?
All I could eat was McDonald's hamburgers. As gross as they are, that's all I could stomach for a while.
They have like the lemon drop, pregnancy.
Lemon drop?
Yeah.
Yeah, there's different things. I know they have ginger candy, ginger gum, different things people come up with. I don't know. If they believe it works, then go for it. As long as it's not harmful to the pregnancy. Eating smaller, more frequent meals, avoiding overeating and lying down after a meal might help with the heartburn. You should wear a well-supportive bra throughout your pregnancy and afterwards. A cool mist vaporizer might help with the bloody noses or the nasal stuffiness. Avoid repetitive hand movements. Elevate the arm for that carpal tunnel, which might come about with the hormones and the tendency for the hand gestures. I probably will get carpal tunnel simply because of the hand gestures. In fact, I'm a little sore. Urinary frequency. Well, you need 2 to 3 liters. If you go to bed at 9 o'clock at night, I would say don't drink the bulk of that 2 to 3 liters after 7 p.m. so that you have to pee out the 2 to 3 liters after you go to bed. So getting in your 2 to 3 liters earlier in the day and dropping down your fluid intake later in the evening might help you with nighttime urinary frequency. Do the Kegels. I mean, I have to say that, right? And I think it's probably important for all of you at this time to do at least 10 Kegels. Just stay with me, folks. Got an hour left. Stay with me. A Kegel will do you good. Huh? Go ahead. There we go. Thank you. All right, as I mentioned, UTIs are common, so good urinary health. Pee when you have to. Clean, cotton underwear, front to back wiping, all sorts of things. Peeing before and after intercourse. What else we got? Oh, changing position slowly might help with the faintness. I used to get calls all the time from like harried school nurses saying I had a teacher, pregnant teacher, and 4th grade teacher almost passed out in her class. What should I do? Or the teacher themselves would call and say, "Whoop, I almost passed out in class. What should I do?" Well, probably not stand still up in front of the class like I'm doing for 4 damn hours, right? Sorry. Remember all that blood down below here? Guess what's not, if you're standing like this, guess what's not having a good time trying to get back up to the head? So they pass out, or nearly pass out, freak everyone out. So even just moving around, sitting down, even simply propping their foot up can help. All right? So somebody said, I was washing the dishes at the sink and almost passed out. And I said, well, I say somebody else should be washing the dishes. All right? And that really goes for several years postpartum. Just a little. We need to use good body mechanics. The more center of gravity shifts, the more that relaxin and those hormones there causing possible injury to muscles and joints. Really, good body mechanics are so important. When you're doing your Kegels, take a moment and do a couple pelvic tilts. All right? Not like in the grocery store or anything, but at home. Just when you're falling asleep, do some pelvic tilts. As I mentioned before, leg cramps, heat might help, like dorsiflexing the feet, but also taking a look at the diet, calcium intake, that sort of thing, can also help. If the hemorrhoids and the constipation and the nausea and vomiting wasn't enough, let's throw some flatulence in, huh? Just to top it off for everyone. Chew your food. Completely avoid gas-forming foods. Sleep in a semi-Fowler's position might help with some dyspnea, and increasing your fluid and your fiber and all that sort of thing can help with constipation. Elevating the legs is not like just a little bit, although a little bit's better than not at all. But when we're talking, if somebody has extreme swelling of the legs, we want them to elevate above the heart. So this is above the heart, and then that is the wedge underneath so that she's not flat on her back. I think it's important that you go back to like a 60s, 70s decorating motif also.
She looks like she's in a barn. It looks like
Oh, really? To me,
bale of hay.
okay. I see shag carpet. Anyone else? Gold? The gold look? Yeah?
I see a bed.
You do.
Yeah.
That looks like a side table all the way in the left.
All right, whatever it is, it's fashionable. We'll say retro. We'll say it's retro. All right. Hemorrhoids, whether you're pregnant or not, there's very little we can do, certainly during pregnancy, but avoiding them might help the best. All right, so avoiding constipation, that sort of thing. Ice packs, sitz baths. Ice packs will just help with the swelling. Sitz bath promotes circulation. Pee when you have to. Drink all your fluid earlier in the day. You know, some people will say, women, but not just the women, some bosses, spouses, children, whatever it is, expect that a woman, well, while they're pregnant, can carry out their activities as if they weren't pregnant. Well, the baby's not born yet, right? Well, yeah. But if you stop to think, my body is growing another human being. I need a nap. And the one who needs to be told that the most is the woman herself, I do believe. Rest period. That's okay. You are growing another human being. So much is happening within your body. Take a little break. And I'm not talking about a 4-hour nap in the middle of the day. Although, why not? But I mean, there might be some adjustments you need to make in your go lifestyle. And that's okay. It's really, if everyone's on the same page with that, all the healthier for the couple themselves. There's all sorts of things we can do. We do encourage regular dental checkups to the health promotion, and also it can help with bleeding gums and that sort of thing. Braxton-Hicks contractions. They might actually start as early as the first trimester. You might feel some crampiness in the first trimester. They feel more like period cramps in the first trimester. Later in the pregnancy, Braxton-Hicks contractions are they're just it's not a real contraction. I hate to say it that way. It's just the uterine muscle flexing, we'll say. It's just getting used to its size, maybe rebelling a little bit, but it's not changing the cervix. I just had a meme that I'm going to try to get. Clearly, I am a bit technologically challenged, but I found a meme that I emailed to myself, because that's all I know how to do, that said Braxton and Hicks met at a bar and nothing happened. Something along those lines. What's it's saying is Braxton-Hicks contractions don't change the cervix. That's the difference between preterm labor and Braxton-Hicks contractions. They're just the uterus flexing. But usually, if it's coming along in the second trimester, the doctors are getting a lot of calls like, I feel like I'm having contractions. There are things that we can do to differentiate whether the true labor contractions or Braxton-Hicks contraction, and we will counsel a woman through that. Drink some water and rest. If you're resting, get up and walk around. Like changing your activity will help them go away. They should not get longer, stronger, and closer together, like the normal progression of true labor contractions. I mean, they certainly will not change your cervix, which would involve an exam. So, calling the doctor is fine. The sooner we figure out that they're Braxton-Hicks contractions, the next time the woman might recognize that that's what they are and will not be so stressed. I talked about supine hypotension, laying on the back, getting really dizzy. It is the compression of the vena cava. Lightheadedness. Down they go, or down they stay, because they're already laying down, thank goodness. Really important to remember that, the weight of the uterus and the vena cava, because that crosses all areas of nursing, right? If you have a pregnant patient in the ER for something, you're an ER nurse, you're not an OB nurse, but get them on their back and you're going to have a whole heap of trouble. So keep that in mind. Some women can work right on up to their due date, or until they deliver. It depends on their job and their comfort level. I had a coworker. We worked the evening shift together back at a period of time. She broke her water. She was having her third baby. She broke her water. Didn't really want to tell anybody because she wasn't contracting or anything. She didn't want to use up her vacation time quite yet. So she came to work. She did me the favor of telling me that her water broke. So here I am working with her. She put herself on the monitor, which I thought was nice. Checked to make sure everything was good, which is also nice. I let her take a longer break, because I'm nice that way. Anyways, she completed her shift. And she didn't go all the way home. She went down the hall just to take a little nap. Woke up like 2 hours later, delivered within the hour. I'm like, that is a Wonder Woman! Talk about working up to the end, right? I don't recommend that necessarily, but it's possible. Some people, again, like line workers. When I say line workers, I mean like high-powered electrical line workers. Maybe shouldn't be working up to the last minute. You know what I mean? Things like that. You got to take into account the exposures and the hazards of the job. And also complications of the pregnancy. Simply comfort level of the patient. Literally, I couldn't walk, in the end of my pregnancy, I could not walk down the hall without having major contractions that hurt, that kept me from working. Little did I know, 5 weeks later, I'd be delivering. You know what I mean? But I kept trying to come back to work, and they finally said, you just gotta stop. Besides, we don't have any more scrubs that fit you. No. Just kidding. We wore white scrubs then, so imagine that. Huh? The Michelin man, right? I was cute. No, I was cute. Traveling could be a problem if you're getting on a plane and going far away, right? Towards the end, some airlines actually have some sort of rules, right? How the heck do they know what gestation you are? But anyways, neither here nor there. Really, you should not be going too far away. Why is that? Because you could have complications in Georgia, where you're going, and everybody who knows you and all your prenatal care is up here in Connecticut. International travel is probably even worse. But, with technology as it is, I'm sure, we can get the information to you, particularly if you have to go away. Take your prenatal record, take a copy of your prenatal record with you. Know the numbers of the doctor's offices, the fax numbers. Take a release form with you, something. And wherever you get to, know where you should go if there's any complications. Just so in the stress of the moment, if something is going wrong, you're a little more prepared. On top of just being in the wrong place if something should go wrong, prolonged sitting is not recommended for your increased risk of DVTs. and using a seatbelt is important, but I just saw something, of course, on my source of news, which is Facebook, and YouTube. Huh? All right. It's this harness thing that puts the lap part of the seatbelt lower down on your legs so that it's not hitting your belly right where it shouldn't be hitting your belly. So I know some pregnant women stop using the seatbelts because it's uncomfortable. Well, so is going through the windshield. So that shouldn't be a good reason not to wear a seatbelt. But there are different things that can be done. But encouraging safety during pregnancy is important. But travel can complicate things. Pregnancy can complicate travel. What's that?
My mom went to Brazil with me. Like, she wanted me to be born in Brazil, but last minute changed her mind.
Mm-hmm.
And here I am.
Yeah, well, bienvenido. No, is it Spanish or Portuguese?
That's Spanish.
Yeah, I know that. I'm just
Yeah.
wondering. Well, we're certainly glad she came back. It's probably not recommended to travel that distance
No.
with you, but
Not at all.
we're glad you're here.
Thank you. Thank you.
Again, we talked about immunizations, how important the flu and the Tdap vaccine are, but avoiding live vaccines. All right? So we might find out a woman is rubella not immune. We're not going to give her rubella vaccine until the day she's leaving the hospital after she delivers a baby. All right? We're not going to do a chickenpox vaccine, say, anything like that, because these are live viruses. All right? But we will know if they're immune to some of these things and counsel them in avoiding the German measles. Not sure German measles is around all that much anymore, but we certainly want to protect them from certain viruses. Regular exercise, I talked about 30 minutes a day is important. Regular rest periods. You're growing another human being. Some women start different exercises to prepare for childbirth, which might be the breathing exercise. It might actually be some strengthening exercises, stretching exercises. As you know, big fan of pelvic tilts and Kegels. So why not stress the importance of those during pregnancy as well. Go ahead, have sex, unless you have some sort of complication, a high-risk situation. They'll tell you that you can't have any sort of activity in the pelvis at all. Some couples feel like they might hurt the baby. I say, get over yourselves. It's not going to happen. All right? It's not going to happen. All right? You might have to change position for comfort reasons, but the head is not going to get hurt. All right? That's all I'm going to say on that. More importantly, some couples have experienced a little stress and change in desire and need for intimacy. It doesn't mean that it's all ruined. It could be hormonal, it could be body image changes. There are some women who cannot get enough sex during pregnancy. It's probably hormonal, and they know they're super women, and they want to share that, right? Some men feel the same way about their partners, like, wow, this is a gorgeous woman growing my baby. Wow. But then some fear takes over and might interfere with desire, blah, blah, blah. I can't go into, I'm not a sex counselor, clearly. However, it's important to encourage the communication between partners, because something as simple as, you know what, I just need you to hold me. It doesn't have to lead to sex, does it? No, you're not going to hurt the baby. Please. Have sex. Whatever. Communication. Key to, keeping the relationship healthy. So there definitely are some pregnancies that sex would be contraindicated, threatened miscarriages early in the pregnancy, any bleeding during the pregnancy, all sorts of things. We have to consider that all medication passes through the placenta. Not all. There are some that actually don't. But if you just consider all medication passes through the placenta, keep that in mind to pass on to your patients, because we need to find out if that medication that's passing through the placenta is harmful for the baby. And it might not be what you think, all right? It could be an over-the-counter medication that you think, well, I just bought it over the counter. Well, ibuprofen is dangerous during pregnancy, right? There are different cold medicines that you should avoid. There are some cold medicines that are safe to take. There's some that aren't. So over-the-counter medications, even more so, I think, because you don't have a doctor prescribing them or a practitioner prescribing them. If you're caring for a patient outside of the OB world, it's important to know if they're pregnant. So if they're not willing to tell you, you have to ask if they're within childbearing age. I think they still ask me. Please. It's not going to happen for a number of reasons. But it's a responsible thing to do, is to ask, because you can't assume anything. And there's maybe the patient themselves assume you know that they're pregnant or whatever. So you're giving them an antibiotic for something, and if you knew they were pregnant, you'd give them a different antibiotic that's less harmful. If you look at any medication, herbal supplement, any over-the-counter medication, you're never going to see, if you're pregnant or nursing, yeah, go ahead, take it. Even if it's 100% safe, if pregnant or nursing, consult your physician. There is no, I challenge you all to look at all the boxes wherever you are and tell me if any one of them says absolutely safe for pregnancy or one breastfeeding. I've never seen it. Prove me wrong. Go ahead. Just kidding. So it's that important before you take anything to consult the physician. If you are the person facilitating the care as a nurse, make sure the prescriber knows the pregnancy status. If you're over 35, you got the whole larger list of risks. That's all it is risk until the actual. Women over 35 tend to have more comorbidities, if you will, underlying medical issues that might be more evident as they get older. They're at higher risk for pregnancy-induced complications. If you're fat, you have more chance. Fat, I'm sorry, I don't mean to be insensitive. BMI greater than 40. You're at higher risk for different complications. So if you're old and fat, that's a lot. I'm just saying that those two issues, you think, that's not fair. We're not judging anyone. Evidence proves that there are higher risk complications. So we're going to be watching the older woman or the heavier woman, monitoring her and her baby so that those risks can be minimized.
If it's like their second baby if it's their first baby at 35, are they at more risk if it was
First time moms are at higher risks only because we don't know what her risks are. Some we might already know, oh yeah, she's going to be diabetic because it happened the first time and she wasn't even 35.
Right.
But it's simply the age during the pregnancy. Yeah, I already kind of talked about that. There are you can read about the increased risks for that population. All right, you got some Leopold's. Leopold's is laying of the hands. All right, we got a nice baby going on in there, but where woman comes in, the practitioner is going to lay their hands on their belly with permission, and they're just feeling. You don't have to memorize the maneuvers or anything. Just feel in the belly. Somebody who's practiced and been doing it for a while can tell where the smooth back is of the baby's back. They might feel some, nubbies on one side. That's probably elbows or feet or something. You can tell the difference between a butt and a head that's up. So you're going to be doing these positions, which is good. You can kind of tell how big a baby is by doing that. You can definitely, even more so, tell the position that the baby's in. All right? And that's just added to the low-tech nature of what a visit can be. There's some danger signs that we're going to talk about in the high-risk section, but it's important for the healthy woman to know if she's having any of these symptoms that she should contact her physician or go to the emergency room. All right, they continue on this page here too. Just which may not be an issue, may not be a complication, but change in fetal activity, abdominal pain. Think about a flush, dry skin, fruity breath, rapid breathing. What's that sounding like to you? Yeah, glucose, yep. Got the diabetes going, right? So if they feel that, they really should mention it because of the complications to the fetus, all right? Hypoglycemia, hyperglycemia, neither are comfortable, and both can be indicative of complications. Weight gain. It's not just a baby, all right? All of these other things add up to actually more of the weight gain than just the size of the baby, all right? All of this adds up to about 25 to 35 pounds, which is the recommended weight gain for an average weighted woman, all right? Normal weighted woman. I don't like using normal because these days that might not be all that normal, all right? Underweight woman, we want her to gain a little bit more. Overweight woman, we want her to not gain as much. It doesn't mean that we want her to gain that 25 to 35 pounds of the pregnancy weight, but the overweight woman is making better lifestyle choices so that if she wasn't gaining the 25 to 35 pounds of pregnancy stuff, she might actually lose weight. Does that make sense? So the underweighted woman is making different lifestyle changes so that pregnant or not, we'd hope that she'd put on a couple pounds. Send her to the Italian grandmother. That should take care of it, right? Just say, oh, you don't feel well? Have a cookie. Oh, here, have a snack.
No, it's more like, oh, you're full, have more.
Yeah, oh, you're full. Oh, you couldn't be full yet.
Oh, you don't love me. Eat more.
You don't love me. That's right. Oh, but I love you. Here, have some more. Oh, yeah, all that. That's all you need to do, I think, with the... So that's important to know, I think. And we're not judging the obese woman. We just want, or the underweight woman, we just want her to make better choices that maybe she can continue actually throughout her life after. Obesity does cause risk. So risk to mom, risk to baby, certainly risk after pregnancy as well. And some of these are those risks. Okay, this is important. The very first trimester, we would expect a small weight gain, like literally 2 to 4 pounds, or what is it, 2.2 to 4.4 pounds in the first trimester. Just a little bit. It's probably the start of the increased blood and tissue fluids. It's not a whole lot of baby yet, but things are happening, right? The second and third trimester, we would expect 1 pound per week. That's pretty generous. All right? Quick and easy. If I am coming in for my visit at the 28-week mark and I weigh 120 pounds, clearly, what would you want me to weigh 4 weeks later at my 32nd week visit? 124 pounds, right? 1 pound per week, all right? Quick and easy way. If a woman comes in and she's gained 8 pounds in that time, and she hasn't just come back from a cruise, we got to look at everything. Are you making the right choices? Or are you swelling? Is there a complication that's happening that's having you gain weight, win fluids?
Do they take into your activity level? Like what if you're still working out?
We would still want you to be gaining a pound a week. Yeah. Because that's baby.
Right, okay.
So, people always want to know if the quizzes in advance have math on it. Yes, they do. All right, I'm not sure you need a calculator, but you're certainly welcome to bring one next week. Okay, for a quiz. We have a quiz every week until you go on to pediatrics. Oh, yeah, in the final. Yeah. All right, we want more calories. We want even more calories in the third trimester. Right? Afterwards, if they're breastfeeding, we want even more calories after that. Okay? I think I put a page number. Did I put a page number on there? If you want specifics about nutrition, by all means, read those pages in the ATI book. Protein is important. We all know that. I'm not going to go over that so much. But we do want a certain number of servings of that with good fat. The requirements for fat don't change. But there's protein in ice cream, right? Dairy. Calcium, yeah.
That's why I gained like 15 pounds.
Because of ice cream?
I ate that every night.
Yeah. Water, we talked about that. We want the omega-3s, DHA. Back in my day, in my pregnancy, folic acid was the thing to have, right? For spina bifida and all sorts of things. DHA is the bigger thing now. I mean, still folic acid, but DHA found to help with brain development and that sort of thing. DHA, the best source of DHA is actually oily fish. Well, you don't want them to have oily fish because of the high mercury contents. There's so many things.
I thought you couldn't eat, yeah.
Yeah, right. So that's the problem. So prenatal vitamins actually have DHA in them. Anemia. It's important for you as nurses, if you're dealing with an anemic pregnant patient who's really stressed out because she doesn't want her baby to be anemic, you can tell her that most likely the baby's getting what it needs. It's just taking it from your reserves. So that's why you're anemic. All right. In extreme cases, they can be anemic as well, but the baby will most likely just leach off the mother. Some will take a supplement, an iron supplement, which is often complicating constipation and that sort of thing. Ensuring that they are compliant, we might add a colase to the mix for them, and the colase can be taken during pregnancy. Vitamin C enhances the absorption of iron, but there are some things like bran, milk, egg yolks, coffee, tea that inhibit the absorption of iron. All right, so if you had a choice, take your iron with a glass of orange juice, not a glass of milk. All right? Pica. Anyone heard of pica?
Eating crazy things.
Yeah, it's amazing. And pica is fairly common during pregnancy. All right, we'll talk a little bit about that. But I will say that pica may be associated, is certainly more common with iron deficiency anemia. So it's the body's seeking something, right? I'm not sure that the body is actually seeking the laundry starch that's being eaten, but that's a sign that there might be asking for something different. It's pica I find very interesting. It's the persistent eat of non-food stuff. It can be something as you think as harmless as ice, but if you're chewing ice the way I know a lot of people chew ice, pregnant or otherwise, you could be doing damage to your teeth. You could also be going into water intoxication, like too much fluid on board. But it's not dirt, so maybe that's okay, right? So there's some things that can be harmful, but it doesn't seem to matter. Pica is an amazing thing. I asked my class a couple of years back, has anyone experienced pica? And what was it that you know, had anyone heard, and maybe I ask you, has anyone experienced it or known somebody to practice pica or hold off on it but want it? A woman said that during her pregnancy, she had a very strong urge to eat the pink foam of her curlers. She did not. She said she did not, which I'm not sure I believe her, but no. Pink, she goes, I have no idea where it came from, but it was related. The minute I delivered, I no longer had the urge. It baffled me, but I could not unfocus from my urge to eat the pink foam on my curlers. Like, huh, were you anemic? She was. There's different things that people crave, that some carry out the actual eating of it. Some can substitute, like maybe powdered milk for laundry starch. I don't know.
I'd rather have the laundry starch.
Than powdered milk? I know. I don't know. But it happens, and I find it just fascinating. Some cultures encourage it maybe more than other cultures, and I don't know if it encourages or don't discourage it maybe, and find that that's helpful. But it might be certain ethnicities that are more prone to anemia, for all I know. I don't know. Maybe it's a combination of both. You could still have a couple cups of coffee. You want at least 1,000 milligrams of calcium. You want your folic acid. Vegetarianism might add some, not complications, but you just want to make sure you know what kind of vegetarian they are and how they can get their adequate intake of all the nutrients. Guess that's it.
So,